Hi everybody, so welcome back to my channel. So this is part 2 of my COVID-19 vaccine. So again, this is Dr. Connors and thank you for being here. All right, so I was talking about the vaccine, the two vaccine that is being produced by Pfizer and BioNTech and as well as Moderna. So the new data, early data suggested that both vaccine have been both effective in preventing COVID based on over 43,000 participants on the one with Pfizer, and the one with Moderna is about 33,000 participants, and it was found that they are over 90% effective in preventing the vaccine. But of course, these are just early datas. Okay, very, very early. As I said earlier, that vaccine, it takes 5 years, 5 years to develop. But this one, it only took about like 6 months. And, which is very fast, but given the circumstances that we have, okay, so it is necessary to speed up the process. Now, there are two things here, okay? Although, the first round of our studies, and there are so many people, the participants, so many participants who participated in both studies. It's very early. The data is really, really early, but it is promising. It is promising that we will be able to curb this pandemic, finally. But it is not a cure. It is just something that, prevent us from spreading further. But the disease is not going to disappear. It's going to stay here a while longer, like, probably in different strains. But you know how viruses are, they go into different strains. And, we thought that when we developed the vaccine for SARS-1 in 2003, we thought that, that was it, that we could just take it from there and, develop the vaccine once then there's another outbreak, but apparently this is a different strain. This is deadlier than it has infected over 54 million people worldwide. And I don't know the data, how much, let me just see if I can see, because I don't want you guys to quote me on this one. All right, so I was right about that at least 54.5 million people are infected so far worldwide, and it has killed over 1.3 million people worldwide. In the United States alone, it's over 200,000. And the number of infections here, they are increasing daily instead of curbing it. So anyhow, as much as it's promising, it's that, it's very promising, the effectiveness of the vaccine. And then we're just gonna go and say, hey, there's now a vaccine, so we can just go and let our guards down and not be carefree again. I have news for you. I don't think that removing our mask will be in the immediate future. I think that we would be wearing our mask for a little bit longer than we would want to. And because during SARS in 2003, the people in Hong Kong and in China and also in Taiwan, all those most affected areas, sorry, they continued to wear masks. They continued to wear the mask, and they continued to follow, the guidelines, public health guidelines that were imposed back then. So I know in 2008, was it 2008, during the Olympics? I was actually in Beijing, and everybody, basically most of the Chinese people there, they were wearing masks, and when I was on the train, they were wearing masks. These are just mask wearing, society. And the contact tracing, it's still a very effective way in trying to prevent further infection. It's like, and I know that, okay, the holidays are coming. You want to be with your family, but these are special circumstances. I have been seeing like posts on social media, like saying that, oh, the government cannot stop us, from being with our family. But you know what? You have to make a little bit sacrifice in order to preserve humanity. Okay? Because if we're not going to cooperate because you feel like the government is infringing in your freedom and liberties, it's just absolutely selfishness on part of us citizen. And that is the only way for us, to curb and to stop the pandemic and to stop this mass killing, by this virus. And and I'm not, saying is that it's okay, but I think that there should be a worldwide guidelines of how to prevent the spread, because there are other countries out there that are so much more strict, and they have the most stringent, COVID pandemic guidelines. Quarantine or restrictions in the world. I will name it the Philippines. You can't even go to the next village without getting a pass, from the government, and you have to state, I believe, your business in order to go to the next village, so that in case you're not, in case that you are a carrier, they know exactly where to trace the people. So we are right here in the United States. We are so much about into this, protecting our privacy, and yet we don't stop sharing our personal data, our personal information, on the internet. Once that you are on social media, you basically have no privacy. Okay, you share it anyway. So, anything that you put on social media is your information. So why don't you, so adverse in sharing your information, to prevent the further spread of the disease. Okay, I know that's like two different things that I'm discussing here. I'm discussing the mask and also the contact tracing. The mask wearing it has gotten a lot of pushback, right here in the United States, particularly here in the United States. I don't hear anything from other countries. I believe that this is the only country where there's so much pushback from the citizen about wearing masks. And, we're not going to stop this. the United States is not going to stop. It's not going to, even with the vaccine, if we're not going to adhere to simple or public health guidelines, because if we don't, it's right now, it's the best bet for us to curb the further spread of this disease is to cooperate, follow simple public health guidelines. It's not going to hurt us whenever we are around with people. Okay, you wear your mask and you keep your distance, your social distancing. Okay, that's and avoid all this gathering. What is it? What is it? We have a pandemic going, and here we are. This is the only country where there are demonstrations about masks and about everything else, where there's so much defiance. I don't understand it. So I really don't understand it. So anyway, I know I get very, very excited because, like you, I want to be able to go back to normalcy, life normalcy. But unfortunately, I think the life that we knew it prior to the pandemic, I don't think it's going to come back anytime soon. All right, the traveling, I mean, it's like, it's the entire world. It's the entire world has stopped. Okay, there's no tourism. I mean, the Americans are not welcome in a lot of these countries because, it's like we have the most cases here in the United States. And we have to have a much more stringent, public health guidelines at the federal level, in order to stop the further spread of these disease. It is real. I don't know why, like some Americans don't believe in science, they doubt the existence and the dangers of this virus, as if they are the only nation affected by it. It's the entire world. The entire world is affected by this virus. So, I mean, that's that's about it. That's about it. I know we are, and the one thing also is like, this vaccine apparently is going to be free for all Americans. But what about the entire world? What about the poor nations? Are they going to get it for free? So that's the question, right? That's the question. Already these third world nation, they already have a very weak public health system and the healthcare system. How are they going to afford? Are they going to be able to distribute the vaccine to everybody or the entire world? I mean, that's the question. All right, so we're going to prevent it in rich countries. What about those poor countries? So, it's like we need to eliminate it worldwide, not just in one section of the world. So again, thank you so much for being in this channel. Please subscribe and like. And again, this is Dr. Connors, and thank you. I'll see you in the next vlog. Thank you very much.